Hey guys, Bill Ruzicka here, and this is my video on nursing ethics for contemporary healthcare environment for my class here at Gonzaga. Well, we're all at Gonzaga, so I guess it doesn't really matter. But regardless, honestly, when I saw this assignment and what we needed to do with it and how we needed to make a video on it, I kind of rolled my eyes a little bit, honestly, because we just gone through some ethics training at work, and it was stuff that was forced on us from administration. So me being a stubborn person that I am, I have a tendency to want to do the opposite of what we're told to do. So when we're told to take ethics training, I wanted to go the exact opposite route. But that's just my my personality and the way that I think sometimes coming through there. But anyways, this is about nursing and ethics, and I really think that nursing and ethics together kind of goes hand in hand, because we're all in this to help our patients. We wouldn't have gone into nursing if it wasn't for wanting to help people, right? You know, we're not in this for the money. We're not in this for the glory. Yeah, sure, there's some of us who, you know, get a adrenaline rush off of helping people out, especially in emergency situations or stressful situations, and we make a really good call or diagnosis on something and we're able to help the patient out. That stuff is awesome. But I think with nursing and ethics, you know, we're responsible for a lot of very ethical things in just our daily routines that we do with patients. You know, we've got narcotics that we have to give our patients, and we need to be responsible for those narcotics. We need to be ethical with the background and history of our patients, whether they were a drug user or maybe something with an alternative lifestyle, or something with their religion, or maybe a disease that they have. You know, just for example kind of stuff. For me, I work as a surgical nurse, so I have a very limited time that I get to build trust with my patient, you know, 15-20 minutes at most, and part of that is reviewing their chart. So before I even get a chance to talk to them, I've got a little bit of a history as to, you know, what their background is, where they're coming from, and why they're there for surgery. Of course, we have to find out their name and identify them, you know, with their armbands and their allergies and their correct surgical site and everything. But once we get through those formalities, we're left with kind of some free time to really build trust with that patient, because for, you know, some surgeries, hour and a half, 2 hours, they're entrusting their life into our hands and the anesthesiologist and the surgeon. So it's important that we build that trust with our patients, and part of building that trust with our patients is not doing it in a way as an actor where you're putting up a false personality of who you really are. It's you honestly building trust with that patient, because they're going to entrust you to be their eyes and their ears and their advocate for them for the next hour and a half, or, you know, however long their surgery is. So if you come in with the idea that you can't treat someone with respect and you can't treat them as equals, you know, say for example in one surgical bay you might have one of the higher up CEO or something like that from the hospital, and in the next bay you've got a homeless guy who is basically going to get a free surgery because of the way that state insurance works. So it's important that you build that trust with your patients before you even take them back into the room and you're putting them under for anesthesia. You can't let, or shouldn't let, that patient's background, you know, invade your thoughts and force you to make decisions that are going to be detrimental to the patient, more or less. So those are the sort of ethical things we have to deal with, you know. In surgery, there's sometimes the idea with some surgeons where they may not want to do a certain treatment for a patient because they know they're not going to get paid for it. They're not going to get reimbursed for it from the state. So we have to be we have to walk a thin line like that in surgery sometimes, and that's an unfortunate part of what we do, but it's a reality of what we do. But still, treating that patient with the same respect and the same way that you would want to be treated. You know, I come from a background of faith where I believe that Jesus loves all of us, and He asks us to do the same for our friends and our neighbors, and to love one another as He loved us. And that's something that I try to convey when I work with my patients, and I hope to be able to do that in the future as well. So that's my thought on nursing and ethics. Hope you enjoyed the video, and I will talk to you guys later. Bye-bye.